Welcome to the Low Back Pain Lifetime Elimination Program. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we help people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. So by now you're having fewer episodes of pain. You're also noticing you're moving a bit better. It's still there. We're still a little cautious, which puts us in this low stability. So we're low irritability, we're high mobility, but we're low stability. So today's video is going to be full of stabilizing, core stabilizing exercises to help as we then begin to move more. We're going to feel more secure about our core stabilization. With this video, you won't need any equipment, just a little bit of space, because we will go from our back to our stomach into some standing and sitting exercises. So just a little bit more space than what we have been dealing with in the past. We always like to start with a warm-up, so very easy. Begin with knees together, working trunk rotations. Again, always be careful not to get too careless with just going flopping back and forth. Okay, did the warm-up. We have a warm-up for a purpose. Be intentional about preserving health and getting our body ready to move, especially our back. So trunk rotation side to side, usually 5 to 10. Just introduce that movement. Go right into easy posterior pelvic tilt, draw in, start to work a bridge. If you can't quite get up very high at first, that's fine. Just allow that body to catch up, allow it to get moving, draw in, pelvic tilt, bridge. Make sure we're still doing this correctly by getting all that pressure from our glutes into our hamstrings to produce that movement, getting our hips off the table, draw in, staying flat through that low back. We should not feel any compression, any pressure through that low back. It should all feel glute squeeze, hamstring contraction, feet are flat. Notice the knees are not pulling together. 15 to 20 of these. We're going to want these warmed up, nice and smooth. Keep working until you get through and you're ready to warm up. Good. First exercise that we're going to start new today is very similar. We're going to bring this ankle across onto the opposite knee. We want our foot to be flat and secure on the ground, because then we're going to bring a little bit of a trunk rotation with it. But what we're doing is we're getting some hip mobility. Very often, and it's okay if this comes off the table, we're okay with that, but we're getting hip mobility and loosening up a lot of this tension that's gathered and locks up our hips. 5 to 10 seconds here, and then we're going to come back. And then we're going to repeat 5 to 10 seconds. As we get down into this position, again, notice the foot stays flat. If we want to move it out this way a little bit, that's fine to do. We're going to get a lot of this stretch all across this back side into this low back, high hip musculature, and get some more hip mobility. Go ahead and push pause, repeat that 8 more times on this side, and then you're ready to push play. We're going to do the same exercise to the other side. Same thing for this other side. Biggest keys here, making sure that the ankle stays locked on that knee. That's kind of what's going to give us the leverage that we're looking for as we then pull it across, coming down. Making sure this shoulder, if I didn't mention it before, making sure this shoulder is staying down in contact. We don't want to roll off this way, because we're not going to get that wringing out motion that we're looking for to get this hip mobility to improve. Now you notice we're only holding 5 to 10 seconds here. We don't want to overcook that low back, overstretch it. We're keeping it warm and loose without getting too much stretch. Same kind of thing on this side, feeling it all across this low back into that hip. Good. Repeat that 7 more times, 5 to 10 seconds, and then hit play when you're ready to come back. So with this exercise, we're going to start again here in our back. As we do, always begin by centering your spine. We're going to work on leveling our back, pushing it, doing the posterior pelvic tilt and the draw in. Raise this leg up, keep it in this chair pose position. And this first thing that we're going to do, keep this core centered. Both hands begin to put pressure on your knee, as if we're pushing our leg down, but we're not going to let it, and we're going to push up with our knee. We're getting a lot of core stability and hip flexor stability as we work this movement by holding 5 seconds. It's called an isometric or hip flexor isometrics. Doing this helps to align our core as we incorporate hip flexor movement. This is going to be important as we go into future exercises later on in future videos. Holding 5 seconds, alternate. You notice my back is still flat, I'm still centered here, and we're raising up to the next one, holding 5 seconds 10 times. You'll know you need a break, or you know you're not doing it right, is if as you're pushing down, you see as I do, I can lose this core, I lose my center here, re-engage, keep that back flat, draw in, belly is down, and we're holding in this chair pose. Don't worry about bringing it really high and then pushing away this way. We don't want to do that. We want to keep it in this mid-range position without shortening those muscles too much. Holding 5 seconds, 10 times, working this back and forth. Of course, we're still breathing. You notice I'm not lifting off, doing a crunch as I do so. We don't need to do that. Stay relaxed, stay loose, holding down. This is still back and centered. Now, apply as much pressure as you feel you can without getting your head and shoulders off and without getting a lot of pain. You might notice some fatigue through the hip flexors. That's normal, that's okay. We don't want to get more pain in the back, more symptomatic pain as we do. We're doing 10 of these total. This will be number 4, so do 6 more and then come back. All right, this next exercise is hugely important to maintain stability as we start moving our arms and legs, and this is one that we're going to do with our arms. This is called dead bugs. This is the intro progression to dead bugs. First thing you're going to do is get centered here with our core, so we're going to draw in, pelvic tilt, keep that flat and centered. We're going to bring our knees up into a chair pose position, as if we're sitting in a chair like this. Next, we're going to push our arms to the ceiling. They call it dead bugs because we look like we're a dead bug on the ground. The next move you're going to do while you maintain this core stability, this core position, with our back flat against the table, is we reach one arm overhead and hold 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then bring the arm back up. Repeat the same thing to the other side, 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And come back up. Relax at any time. If you feel like you need to relax before you alternate to each side, that's totally fine. Endurance is a huge component to spinal stabilization or core stabilization, so it's totally okay if after you do one, you're tired, you need to take a break. You'll know you need to take a break is if at the end of one completion or even in the middle of one episode of reps, we're losing this core position. If we're starting to come off the table a bit, our back is no longer flat, just stop where you're at, take a break, recenter, and begin where you left off. That's totally okay. What you're also going to notice, keep everything else relaxed. Your neck, you're going to want to feel like you want to come into this crunch position. We're here and we're actually reaching to the ceiling. Don't worry about any of that. Relax all this. Why is this so important? Because they've done studies. When we raise an arm overhead, the first muscle to activate is our transverse abdominis. Our body already knows that we have no distal mobility without proximal stability. And so we have to encourage and engage that reflexive response, that primal response, to keep this core stable and strong so we can kind of hack that natural ability that we have to get our core engaged. We have to engage it effectively so it's more productive to stabilize that spine as we go to reach overhead with whatever it is that we're doing. So go ahead and repeat that 8 more times on both sides, holding 10 seconds. Take as many breaks as you need, be patient, and then push play and come back when you're ready. Okay, for this next exercise, go ahead and sit on up. We're going to get to the edge of the table here because we're going to want to be able to get onto our hands and knees on the table. This is one you've probably seen before. If you're on, I say table, if you're on a bed, that's fine as well. If you're on the floor, that's okay. Maybe a cushion, a towel, or some pillows for your knees will be helpful so you don't have any pain or problems with your knees. But you want to be on all fours. Now from here, This is the cat-camel move, or cat-cow sometimes people will call. Either one is fine. There's a few things that are hugely important to do this right, and that's to match up your breathing with the movement. So the first thing that we're going to do to get a lot of mobility out of that spine is, if we're going to take a big inhale, we inhale, bring that head up, and we flex or bend that back down to the table. And then we exhale and push our hands into the table, let our head drop, and we push our spine to the ceiling. Big inhale. As we inhale, our head comes up and our back bends, and we flatten out. We're going to work this every breath, so it's a little bit faster in real time. Every rep is matched up with our breathing. You can do this 20 to 30 times. It's fairly smooth and rapid. Obviously, you notice we're being patient and intentional with our movements and our breaths. Good. Come back after you've done that 20 times. We're going to stay right in this, we call this quadruped, so it's hands and knees position, and hands are going to be right under our shoulders, knees under our hips, and then we're going to sit back onto our heels. Notice my hands stay out in front of me. If you want to, you can walk your hands out a little bit further. This is called child's pose. It's a great stretch for that low back. You're going to stay right here, 10 to 15 breath cycles. We count the breaths because that's also part of the intention of this exercise, is to work your breathing into your flexibility. You're going to notice on the exhale, you'll have a chance to go a little bit further or to bend a little bit more. And we're trying to work that in. Now, if you notice you have problems with your knees, maybe your knees don't bend this far, or we've had surgeries or issues or whatever have you, that's okay. If you can't quite go that far, you can put a pillow back behind your legs to kind of rest into it. You can make some modifications where you reach out further. That's okay to do. Not a problem. If you can, though, you do want to sit back as far as we can, because we're working to get some of this flex or stretch in our low back as we work our breath cycles. Pretty easy to do. Again, 15 to 20 breaths. Come back once you finish that. This next exercise, go ahead and sit up on the edge of your bed or a table or chair, wherever you're at, but go ahead and sit up. We want you to be supported through your legs, but also able to be upright through your trunk and torso. So if you might remember from the first video, we talked about some of these muscles that attach to that thick band of fascia in our low back, that internal back brace that we have. This is one of them. Our glutes are one, our transverse abdominis are one. This is the third one. So we have muscles that are pulling from the bottom half, muscles that are pulling from the side, and now these are the muscles that are pulling from the top side, pulling up. So think of it like a tarp. Now we're pulling that tarp from all corners and all edges so it stays nice and flat, and we're able to kind of hijack the rigidity and structural support that this tissue can offer. We're doing this through our lats. So our latissimus dorsi, these muscles that come from our shoulder blades on down into our low back. And the way that we do that, by sitting upright, big and tall, we still stay flat or centered through our core. Think that we're not overextending and getting this anterior tilt in our back. We're actually staying level. So if you need to do a quick center or check, put your hands on your hips. Make sure you feel like they're level. If you feel like as you roll forward, your thumbs are higher than your index fingers, then you know that we need to recenter and find out where it's flat and that bucket is level, so that water full to the top isn't spilling one way or the other. Get centered, get level there, put your hands on your thighs, your legs, and then from here, notice my shoulders. This is a big key. Shoulders, they're going to squeeze down and back, almost like I'm trying to tuck my shoulder blades into my back pockets. Often people will think, oh yeah, I'll just pull back. This is incorrect, because what we're doing now is we're getting upper trap activation, pulling our shoulders towards our ears, and we're actually muting our lats. We want to do just the opposite, fully engage the lats, and we do that by muting our upper traps. In order to do that, we have to go down. We have to actually work our scapular depressors, shoulder blade depressors that work down. So we're going to pull down and back, hold 10 seconds, and we're going to do this 10 times. Again, like all the other ones, we want to breathe, inhale, exhale as we count softly to ourselves. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What you're going to notice often is if we're pulling down and then we bring this turtle out of the shell, we pull our head forward, we want to avoid that, bring our head and chin back just a touch, not so far where we get like into a chin tuck. We want to avoid that as well. We just want to stay level or high and stacked. So then as we bring, so you can kind of see as I bring these shoulder blades down and back, I'm pulling them down into my back pocket, not just straight back. Huge difference. So we're doing this 10 times, 10 seconds. Go ahead and do this 9 more, counting to 10, and then come back when you're ready. For this next exercise, go ahead and stand up because we're going to do some squatting technique. And the reason why we're going to incorporate some squatting technique now is because what does everyone say when you have a bad back and how to lift properly is to bend with your knees and not through your hips or your back. But we notice a lot of folks have a hard time with that, or they do it incorrectly, which still puts their back in a position of instability. And so we're going to work on how to squat, how to bend, while maintaining our core and pelvis in the proper stabilization and alignment. So just go ahead and stand up, get close to whatever your bed, wherever you're at in your house. What I also like to do is if you have a kitchen chair, go ahead and turn it around so then the back of the kitchen chair is right here. Now what you're going to want to be able to do, start with your hands at your hips. It's okay if you're looking at your toes, you're looking straight down at your toes, it's okay to be anywhere between noon, right ahead, or between 1 and 11. You're okay. Anything beyond 1 and 11, we're not putting ourselves in the position of the most stability or most strength. So try and keep your toes oriented or pointing between, with your feet about 11 and 1 up towards noon. So right in that area, and again, anything beyond that, we want to avoid. So as you do so, just take a look, see where you're at. Your ankles, knees, and hips should be stacked. You shouldn't be wide or too far outside of your hips. To be like inside of your foot, if the inside of your foot is even with your hips, that's okay. We'll accept that. But for the most part, we don't want to be wider than that. We also don't want to be too narrow. We want to be inside. If the outside of our feet are inside our hips, that's too narrow. That's going to close down how much space our pelvis is able to move. So we want to stay as athletic and active as possible while still staying as stable as possible. Start with your hands and your hips. Just orient yourself, center yourself. Where is that bucket? Am I level? Do I feel like if I stand up, am I tilted this way? You're going to notice whether that's happening just naturally for yourself. That's when you want to fight and work to get your hips level or that bucket level underneath you. So if that water is full to the brim, the lid of that bucket, we don't want to be tipping or spilling forward. And from there, what we're going to do is start to bend with our knees. Now you notice my trunk and torso stays fairly level. Now you're going to think, oh, but now I'm tipping forward with that bucket. I am, but I'm not in relation to my spine. You see my spine? As my spine comes down, it sits on that bucket. It's staying level in relation to my spine. Now as I go down, I bend those knees. I'm being careful to notice where my spine is in relation to that bucket. I'm not dropping out. See how I easy do that and I lose this orientation through my hips and pelvis? That's usually a sign of hamstring tension, or we're not able to get as much flexibility through there, which is why we're doing the hamstring stretch to loosen that up. So as we go down, we want to make sure we're just going to start with mini squats. Just go down to here and notice, how am I doing here? Am I arching? A lot of times people will arch and feel like to get my trunk and torso up, I have to do a lot of arch here. If you're noticing you have to arch a lot, that usually means you're too heavy on your heels. Think about balancing your weight at about the knot of your shoe or middle of your foot. Okay, almost like right where my pant pleat is hanging. In the middle of your foot, you want to stay fairly balanced. Your feet and toes should feel like they're gripping or clawing into the ground, but we also shouldn't get any elevation of our feet off the ground. So be very careful to make sure that we're balancing that weight. Again, there's a lot of information going on with just how to squat. You can see now why it's so important that we go over every one of these elements to make sure that we're doing it correctly. So take your time. Pause the video as often as you need. That's totally fine. Break down every element of that. As we go down, so we're back centered, we're level here with our hips and pelvis, we're lowering down, we're noticing our feet. Are they stable? Are they even? Are they at that 11 and 1 orientation? And then you want to notice, is my trunk angle the same as my shin angle? Meaning that how lined up is my trunk to my shin? If I'm here, you notice there's a big difference, almost too vertical with my shin and too forward bent with my trunk and torso. That's going to cause problems with my back and put me at a position of instability. Conversely, if I try and stay upright with my trunk and torso and I just get all kinds of knee bend, and now you see there's too big an angle through my shins closest to the ground and my trunk and torso is upright, that's not correct either. We want to balance that in between where we stay stable as we do squats. Now, we're not worried about depth yet. We're worried about getting all these component movements in place, getting them as accurate as possible, as comfortable as possible to produce autonomously without having to feel like I got to run through this enormous checklist on how to squat correctly. Because what we need to be able to do is we need to be able to get down to lift, to squat, to pick things up, whether that's a bag of dog food, rice, buckets of water, whatever the case is that we're bending over, kids, grandkids. We need to be able to do that effectively without too much bend here, where we get a lot of this low back issue, and without putting any other joints at risk of injury. So we're going to do this 15 times, smooth and steady. You can put your hands on a countertop, kitchen table, whatever you want to be able to do. Go slow and just make sure that you notice where every joint is as you work through those to do it correctly. So for this next exercise, the mini squat, we're going to go through a lot of component movements. Be patient as I explain everything. I'm going to give you a way to organize your consideration for how each joint is moving and how you should be intentional about arranging or attending to each of these movements. So just be patient with it, okay? Let me explain things first. As we stand up, you're going to notice, put your hands in your hips and notice where you are. Center yourself on your pelvis, making sure, are we level? Does that bucket need to be level so that I'm not spilling that water forward or backwards, as we consider the example in previous videos? From here, I still like to have the hands on your hips, and then you want to look down at your feet and see, am I arranged so that I'm stacked hips, knees to feet? If I notice that I'm too far outside of my hips with my feet, for example, if I notice that the inside of my feet are outside of my hips, that's about as far as you want to go width-wise. We don't want to go too far wide. If we notice that the outside of my feet are inside of my hips, that's too narrow. We're going to get jammed up and won't have the mobility that we need. So arrange yourself where you're comfortably able to stack your hips on your knees, on your ankles, typically no wider than having the inside of your feet underneath your hips. From there, you also want to look down and see, are my feet arranged where they're at either 1 or 11 o'clock instead of right at noon? Now you can be right at noon, that's fine, but we don't want to be inside of noon, and we also don't want to be outside of 11 and 1. If we're hinging over here on 2 and 10, that's a little too far, that's too wide. We want to keep it inside here between 11 and 1. From there, keeping your hands on your hips, we want to start to bend our knees first. Now as we bend our knees, our hands are on our hips, and we're noticing our pelvis is still staying level or aligned with our spine. Now, yes, I'm tipping forward with that, but in relation to my spine, I'm actually stacked nice and even. Now you notice my hips. I'm not diving my hips too far back. I'm just letting my pelvis and hips lower right underneath me. Doing so is very intentional because it's going to help us stay balanced with where our center of mass is on our feet. As we then go down and stack, we notice our knees. Our knees have to stay on top of our ankles. If we cave our knees in, so if you're seeing here and we cave our knees inside of our big toe, we're going to have problems with where we get our strength from our hips. So we have to keep those knees pointed out or stacked on top of our toes, right on top of our feet, making sure that we don't also get too exaggerated with our knees passing in front of our toes. because this next angle is one that I want you to consider, and it's kind of hard to do on your own. But as you lower down, you're noticing my pelvis is level, my knees are staying on top of my ankles, and my trunk angle and my shin angle are the same, meaning that from here, the angle that my shin is pointing upward matches the angle that my trunk and torso are pointing, versus this kind of arrangement where if I fall flat, now my shin angle is more vertical, my torso or trunk angle is more horizontal. We want to avoid that. Additionally, we want to avoid the opposite where we get a lot of angle from our ankles, causing our shin angle to be more horizontal and our trunk angle to be more vertical. We want to match those up so that our shin and our trunk and torso are level or even. Our knees are stacked on top of our feet, and the weight of our body is carried through the middle of our foot. It's very easy. We see a lot of folks to get more pressure on the balls of their feet. Their heels come up, or opposite, we get back this way and heavy on our heels, so our toes come up. We want to avoid that as well. So we stack and we fall almost like we crumble and collapse right down into the middle and stay level. This is hugely important. We're doing this 15 times, smooth and steady. Take your time as you go through your checklist, working from hips down to toes, where everything needs to be in order to do it correctly. Be patient with yourself. There's a lot of information. It's okay if you need to pause, reset, reconsider, look at all the different elements of those joints, because there's a lot to go over. Hugely important when we have to bend over, pick up grandkids, dog food, whatever it is, we're able to stack and secure ourselves from our core, center our core, so that we reduce the risk of injury in the future.